This month, we're observing National Minority Health Month in partnership with Buckeye Health Plan.
As Ohio's fastest growing Ohio Medicaid managed care plan, the Buckeye is focused on addressing health disparities among its members and all Ohioans.
And today, we're joined by Monique Gladden to talk about the importance of improving the health of racial and ethnic minorities and reducing these health disparities. So, Ms. Gladden, thanks for being here with us today.
Thank you for having me.
So I guess we could start with, can you paint a picture of the health disparities that do exist among many minority populations in our community?
Our health disparities with amongst the African American population specifically, and in comparison to our non-Hispanic white community, we have large rates and huge disparities. Minorities are 1.5 to 2 times more likely than white people to have most of the major chronic diseases. In the United States, 13.8% of Black people and 10% of Hispanic people report having fair or poor health, compared with 8.3% of non-Hispanic white people. Black women have the highest rates of obesity and being overweight compared to other groups in the United States. About 4 out of 5 Black women are overweight or obese, compared to non-Hispanic white people. Black people are 44% more likely to die from a stroke, 40% more likely to die from breast cancer, and 52% more likely to die from cervical cancer. Twice as likely to die from diabetes, and 30% more likely to have asthma. Other races are challenged with health concerns as well, like our Hispanic people have higher rates of obesity than non-Hispanic white people, and the rate of low birth weight infants is higher for Hispanic people compared to non-Hispanic white people. And the tuberculosis rate in 2019 was almost 7 times higher for American Indians and Alaskan Native people than white population. In addition, tuberculosis was 33 times more common among Asian people.
And it's one thing we need to know about those disparities, be able to identify them, but then what do you do about them? And I know you have some ideas about that.
Yes, so specifically at Buckeye Health Plan, our mission is to change the community and transform the community one member or one patient at a time. So we're looking at developing programs and doing all we can do one member at a time to help with changing the outcomes with the particular populations.
And Monique, how can doctors and patients work together to sort of eliminate the health risks that are tied to these racial inequities?
There's a lot. It begins with understanding the disparities and understanding that there are inequities and that there is a gap. So education on the side of from the community, the medical community, doctors, and then understanding the populations that you're working with.
And I'm sure you're out in the communities as well. Where can people go for more information if they like it? Because this is so important.
Yes, we're definitely out in the communities. We have lots of programs where we're boots on the ground so that we're really trying to intertwine ourselves into the community. And for more information, you can always go to BuckeyeHealthPlan.com.
All right, Monique Gladden with Buckeye Health Plan, thanks so much for being with us today.
Thank you.
Great information. Thank you.
Thank you.